Hi, thanks for coming.
Hi,
Um,
thanks for having me.
of course. What is your name and position?
My name is Michael Yiallourides. I'm a certified prosthetist orthotist and a residency mentor in orthotics and prosthetics as well.
Okay, and how did you enter orthotics?
I finished undergrad with a kinesiology degree, and I was a little bit kind of like, oh, what do I do? What do I like, need to find a job, figure out something. And I found a job doing post-op bracing at an orthopedic surgeon's office, and it was mostly off-the-shelf stuff at that point, back braces, knee braces, etc. I didn't know much about the field at that point, but I was kind of like, well, it uses my degree, it's clinical, it's hands-on, kind of what I wanted to do. So I did that for about a year. And then as I learned more about the field and how much more it entails, I decided to go to school to pursue my master's in prosthetics and orthotics from that point. So after doing that about a year, I went to grad school and then I've been working ever since.
Right, and we're grateful for that. Can you walk us through your process in treating scoliosis patients?
Yeah, so there's a few factors that go into it. It's a bit of a multifaceted evaluation and process, if you will. It will always start with the patient seeing the doctor first to get the official diagnosis, to get X-rays, to kind of assess what's needed to do, if anything, because scoliosis is officially diagnosed if the curve of the spine is greater than 10 degrees. And even at that point, it's if it doesn't reach a threshold of 20 to 25 degrees, it's kind of considered like, okay, let's keep an eye on it and monitor it to see if it progresses. Once it hits a 20 to 25-degree mark, then that's when we start talking about, okay, what do we need to do treatment wise? Some other factors that go into it are the age of the patient. For example, if you have a 9-year-old with a 20-degree curve, you're going to jump on treatment because that's fairly significant for that young of an age versus if you have like a 15-degree curve on a 15-year-old, you might not need to treat that because of them being a little bit older. So there's a few factors that go into determining what treatment plan, if any, is necessary. But if a doctor deems it needed to treat them with orthotics, then they would send us the referral with the X-ray, and we would do the evaluation on the patient. Our evaluation consists of a few things. We look at the X-ray and we look at the Cobb angle, which is the curve of the spine. We look at rotation and we kind of determine how we need to design the brace. We take a bunch of measurements of the torso, and nowadays it's often what's commonly used is taking a 3D scan of the torso to get like a custom image of the spine or the torso rather, not the spine itself, but we get a custom image of the torso that along with measurements and the X-ray, and that's what we use to fabricate the brace kind of tailored to that patient.
Right, and I noticed when I was getting braced that the braces usually print them with like, is it 3D printing material or?
So they can be 3D printed. I think more commonly is that you use the scan and the measurements to create like a positive image, like a foam model of the torso,
Oh,
and then the brace will be made to that. Because there's several layers that go into a brace, so 3D printing doesn't necessarily entail all of that. Different types of braces could be 3D printed, but the more common types will be molded to a mold or model of the patient's torso because there's layers of padding, there's liner, there's the plastic itself. So there's a little bit more that gets built into the brace than just the plastic, if you will.
oh, I see. And can you describe what a scoliosis brace, once you've finished going through that process, what it would look and feel like for a patient?
Yeah, so the most prominent thing is that it's this like plastic shell that goes around your whole torso. The most common types have like a foam padding inner liner, as well as thicker pads, but the thicker pads are only placed where the curve is. So the braces often look kind of asymmetrical and weird because we're not making it to just fit on the torso, we're making it to press and push and apply pressure where we need to correct the curve. So sometimes they look a little funny. It's higher on one side, it goes down lower on one side. There's like a bubble kind of relief sticking out of this side while the other side is kind of pushed in. So they're kind of weird looking. But they are intentionally made that way because of how we need to position the spine. When you're wearing it, usually the first most prominent thing is just that it's tight. You know, we need to kind of put a squeeze on the torso in order to correct the spine. For curves that are higher up on the spine, we correct it by pushing on the ribs that attach to the vertebrae of the spine. So we're putting pressure, like if someone's curve is this level on the spine, I don't know if you can see, like we're pushing on the ribs here to kind of push the spine into alignment. So tightness is always the biggest one, and then there's certain areas that have more targeted additional pressure because of where we're putting corrective forces on the spine. Um, so the look of it, we more modern braces are able to be a little bit more slim fitting and low profile, but there is still something to it because we need the rigidity and the tightness and the material there to provide the correction that is the whole purpose of the brace. Um, Patients usually will acclimate to it pretty well after a while. We always advise a break-in period when you first get a new brace. Um, Braces are usually prescribed to be worn anywhere from overnight to 16 to 18 hours a day, up to 22 hours a day. So that's quite a lot. So we don't expect anyone to go from 0 to 22 hours overnight. There's a break-in period to kind of acclimate to the tightness, the pressure, and all of that. And usually people acclimate pretty well, but there's always just tightness and pressure. That's kind of an inevitable part of the brace.
Yeah, I understand. I know you partially answered this already, but could you go a little bit more in depth on how you like tailor each brace to your patients?
Yeah, definitely. So the primary thing is going to be each brace is made custom to a person's body. So, some people are taller, shorter, skinnier, rounder, more full figured, whatever, what have you. We make the brace tailored to each person's body type. So that's the number one thing. Oftentimes now, based on uh, a patient's height and weight, we do like a universal compression. So the whole brace will be shrunken down, maybe like 2 to 3% of what the person's like natural measurements are. Um, oh, that's it. Sorry about that. Did it interrupt?
Oh, no, there's nothing wrong on this side.
Okay. Apologies, that something popped up and
Oh, yeah, no problem.
um so that's where we get into the modifications of the brace. So we don't just make a brace to the person's anatomy as is. The brace is made to their curve, their x-ray, their presentation, and all of that. Um, so depending on where someone's curve is, determines how high up the brace comes, how much pressure we're applying. And there's certain kind of minimums of what we need to have in order for a brace to be appropriate. And once we have that in place, then we kind of, when we do the fitting, we adjust it to make it as comfortable as possible. So whether it's trimming the plastic down in a certain spot or kind of adjusting for as much comfort as possible, like my kind of catchphrase whenever I'm fitting a Scoli brace is that it's going to feel tight, it's going to feel awkward, but it shouldn't be painful. So we always try to find that happy medium of like, yeah, I know it feels weird and awkward, but it shouldn't be like intolerable. So once you have the foundation of the fit, meaning the corrective forces and the overall fit is good, then you can kind of tailor it to be as comfortable as possible without compromising the function of it.
Yeah, I heard that catchphrase too, actually.
I think so many braces I fit, I say tight but comfortable, pressure but not pain. Like if I had $1 for every time I said that, oh my gosh, I don't know, own a
Nobody's
yacht or
perfect.
something.
It's helpful though. Um, and could you explain how the brace works and like what it does to correct the spine? Again, I know you kind of partially answered this, but just an overview.
Yeah. So it's a 3D approach now. So, scoliosis is always defined as a three-dimensional deformity. It's not just a sideways curve of the spine. There's rotation to it. Um, usually the first test for scoliosis is like maybe it's the school nurse or your primary doctor or pediatrician, whatever. You do like the forward bend test. And that's because they're looking for what they call a rib hump. And that's because where the curve is, the vertebra rotate, and that causes the ribs to kind of stick out. So, sorry, I got off track a little bit. um, the like the goal, like the purpose. Sorry, I got off track. Which question were we on? I'm sorry.
Oh, no problem. Yeah, no, it's like, how does the brace work?
Oh, so the brace, because of the three-dimensional approach, sorry about that. Because of the three-dimensional approach, you have different aspects of the brace for each purpose. So the brace pushes, like if the spine's curved this way, you're going to have the brace push this way on the ribs. If the vertebrae are rotated one way or the other, you're going to have the brace push on that part as well. So you're pushing from the side, you're pushing from the back, and it's a three-dimensional correction. So it's for the higher up curves where you can push on the ribs. That's the main focus there is pushing kind of inward and forward to get those ribs back in place to get the spine realigned. For lower curves, we don't have ribs in our lower back. There's just the vertebrae of the spine. So that's usually more rotational than anything. That has a usually more aggressive like forward push as opposed to pushing from the side because you want to correct the rotation there. It also acts as sort of an anchor point to counteract where you're pushing on the ribs. Usually, in many cases, not every case, but in most cases, scoliosis has like a primary curve and then what's called either a secondary or compensatory curve. And the body wants to be aligned and balanced. So if the spine's curving one way, your body's going to try to go the other way again to balance itself, which kind of creates a second curve. But in order to correct the primary one, you need to hold that second one in place still. So the brace pushes in like a 3-point pressure system where it's like you hold the spine here, you push here, and then the goal is to get that all to line up like that. I know my excellent animation here. Um, but the brace is designed to basically counteract whatever curve or rotation the spine is doing to get it back into alignment. And the way we're able to determine if it's working is that once a patient has a brace, they do an in-brace x-ray. So when you first see your doctor, you take an x-ray to determine the magnitude of the curve and how severe it is. Once you have a brace, you take an x-ray with the brace on so that you can see how much correction is achieved in the brace. And that's so we call that in-brace correction. And that will usually dictate how well the brace is working and if we need to adjust or modify anything. And that's all just based on that, for lack of a better term, squeezing and pushing that we do on the ribs and on the torso to get everything back into alignment.
Yeah, thank you. And thank you for the animation. Um, do you have any experience with non-compliance? And if so, how do you feel about the prevalence of non-compliance in scoliosis bracing?
Well, there's definitely non-compliant patients. Scoliosis treatment is very interdisciplinary. There's the doctor, there's the orthotist, there's the patient, there's the parents, and in many cases, a physical therapist. So non-compliance more often than not just means you're not wearing the brace. And look, I mean, I get it. It's not fun to have to wear a back brace. That's fair. Um, but the non-compliance usually comes in with kids who maybe have to wear it more hours per day as opposed to just overnight. They don't want to wear it to school, things like that. And it can be difficult because, it's not like I'm at home with the kids forcing them to wear the brace. It has to be up to them and their parents to be compliant day to day. And the truth of the matter is that we just kind of, I just kind of give it to them straight where I say, if you don't wear the brace now, you risk having much more complicated issues in the future. It's wear a brace now, or do you want to risk having surgery later? Do you wear a brace now, or do you want to, I don't know, have back pain for the rest of your life or something like that? Which may sound a little extreme, and in some cases, that's not always the case necessarily, but it's always a possibility. And usually, if when you're able to kind of get on the same page with the parents, that creates a much more effective treatment plan where you can have better confidence that there's compliance at home and that when they come in, you'll see the difference because, like when we do the in-brace x-rays, the reason I'm saying this is because like a scoliosis brace is not going to correct a curve. It prevents it from progressing. So it's not like we can take an x-ray and say, okay, scoliosis is fixed. But what we can tell is if the in-brace correction is improving, if the flexibility of the spine has changed or if it's just as rigid and fixed as it was before. Um, One company even makes these little monitors that you put in the brace that reads like internal temperature inside the brace so that when it's worn, your body temperature like triggers a monitor and it kind of times how long the brace is being worn. So we're able to kind of track compliance in that sense with if you use that company. But the bigger thing with getting kids to comply is finding out how it works for their schedule and for their like day-to-day life. Like, most kids who have to wear it 16 to 18 hours a day, I'll say like, all right, put it on when you get home from school and wear it till the next morning. That's at least like a good chunk of time where that's at least most of the hours, if not all. And then some kids only have to wear it overnight, which usually will create better compliance. Um, but it's important to have everybody on the same page, the doctor, the parents, the patient, and the orthotist all working together just to reiterate like, hey, I know it's not fun to wear a brace now, but if you get this over with right now, then you're done with it and you don't have to worry about anything else like once you're an adult and grown up and whatnot. um it's not foolproof. It's still up to the family and the parents and the kid at home to keep up with it, but we reiterate everything we can of what as to why it's important. And that one monitor with that one brace, it helps because then it creates a little bit of a visual of like, it's not just this abstract idea of like kids might say, oh, I wore the brace all night and I wore it a bunch and blah blah blah, and then you look at the monitor and it's like, okay, you wore it one night over the last 3 weeks. Like it creates a little bit of a visual, which kind of helps reinforce, like, listen, this isn't enough. This isn't going to fix and do what we need to do now in order to prevent complications in the future. So, long-winded way of saying you reiterate what could happen if they don't do the treatment now, and you kind of have pep talks with the parents and the kid to say like, this is why it's important, and I know it's not fun, but we got to push through and do it.
Yeah.
And that's kind of been my approach.
Yeah. And thank you. That's good advice for our viewers. How do you feel about the support or outlook for non-operative scoliosis treatment in general?
I think it's excellent. I
Yeah.
think that with how far bracing options have come, it used to be like scoliosis bracing used to be these metal body jackets where you walked around like Frankenstein kind of, and it like came up to your neck and it was like a little, medieval looking. But it's advanced a lot where kids can wear braces under their clothes and wear it to school and it's barely noticeable. It's become more effective and more advanced where sometimes you don't even have to wear it for as long, like in the grand scheme, meaning like how many months or years or whatever you might have to need a brace, like I think has gotten shorter because of how much more effective the braces are, especially when braces became more 3D as opposed to just like original scoliosis braces just pushed from the sides and that was it. Now it's getting the rotation, it's getting the full spine, the full picture. that the more effective they are, the less cumbersome and less invasive they are. And I think that when somebody is compliant and the treatment plan goes smooth, surgery is never even mentioned. Like it never even crosses the doctor's mind or anything that it's needed because the brace did its job. And especially having things like what we're doing right now and organizations like Curvy Girls and different support groups that kind of normalize it and provide a community. I think it makes it less of a stigma of like, oh, I have to wear a brace, like, oh, it's such a, bad thing or whatever. I think that there's a lot of resources and a lot of options that improve the treatment for scoliosis, and the word surgery never even has to be mentioned. In as many cases as we can. It's, nothing's 100% guaranteed, but there's a lot more options and possibilities now than there were before.
Yeah, and thanks. And sort of along that line, actually, after bracing, are there any, like after the recommended bracing period, do you know of any long-term implications to bracing?
No, no, the bracing is pretty acute as far as like once you're done with it, you're done with it. The during bracing might have some of the side effects, whether it's like skin discoloration from the tightness or things like that are acute. But anyone I've had who didn't need to go to surgery and once they were discharged from the brace, they were free and clear. There's nothing nothing residual. Um, there's no effects as far as like stunting growth or development or muscle development or anything like that. Um, it's really a pretty like consequence-free treatment option by the time you're done with it.
Okay, that's good to hear. And this one is a little bit unrelated, but I noticed when I was, when I searched you up that you have some experience with physical therapy. Can you speak on that as it pertains to scoliosis, or if you didn't work with scoliosis patients, just in general?
Yeah, so my PT background was, I'm not a physical therapist or anything. I just worked in physical therapy before pursuing this field, but I didn't work in Scoli focused clinics, but I did work with a few people who did Schroth physical therapy and people who like different therapists who did focus on spine. The physical therapy aspect of Scoli treatment is about muscle balance. It's about posture. It's about alignment. So, if scoliosis comes from a muscle imbalance causing that curve, then how do we strengthen and rebalance those muscles? So there's different approaches to it. Schroth physical therapy is a popular one that does really, really target and specialize in scoliosis. Different other spine specialist therapists will do different kinds of muscle strengthening. So it's an excellent, excellent um, additive, I guess, to scoliosis treatment, often used in conjunction with orthotics in the back brace. The more it's all kind of tag team effort to just further improve the outcome of like each treatment option improves the outcome of the other, if that makes sense.
Yeah, no, that does. Thanks for being here.
Yeah, my pleasure.
Yeah, that's all we have for you. Unless if anybody has any questions, reach out to us at ScoliPoly and we'll get in touch with Dr. Yiallourides. Thanks again.
Thank you, and great thing you're doing here, and happy to help anytime.